So you know this saying, don't shoot the messenger?
Are you the
You know what that
messenger?
means? So when someone tells you something that's not very nice or not very
Not very cash money.
fun, don't yell at that person who's telling you. Oh, hey, look. So upcoming changes in uniform.
Oh.
Now, so do I really care about this?
No, not too much.
So I really don't. I can't say it enough. But, oh, by the way, I'm not wearing uniform right now, right? So, January 2nd, and they're gonna come down hard. Just, now, the bad news is that, the good news is that in January, guess what you guys are gonna be doing Monday, Tuesday, Wednesday, and then during Thursday and Friday.
Oh.
Alan is coming in, because he's barely gonna pass this. He's gonna need extra help, because he's so late all the time. Everyone else, you guys don't have to come in. But, so during that time, right, basically, it's gonna be right before Christmas, we'll stop, and then almost the entire month of January. Basically, the second semester of Rhinai finally coincides with the second semester of URI. So during that time, you guys can hang out. You can also start working on maybe any late college applications, and then also start working on your PBGR research project. And by the way, if you need help on your PBGR, your research project, your nursing research project, writing it, it is absolutely non-negotiable that you need medical research, some primary sources, not stuff from Google that is like, just random stuff that, you need actual references, the medical references. So physicians will be writing, or PhDs are gonna be writing stuff that you're gonna have to read. Mrs. Gaspar, and I've worked on that since day one. And I always offer to my students, during that January period, if you want, I could absolutely help you. So here's the offer, it's up to you. No, seriously, here's the offer. If you come in and we meet, and you have sort of an idea, I'll get you all your research papers, I'll even help you read them, right? Or interpret them in your own language. Not in your own language, but like so the thing about research papers is that everyone needs to absolutely collect them. And you don't need to read everything, and you don't need to understand everything, but you need to understand something credible, something specific about each of those research papers. And that is absolute minimum. And then you have to do a whole bunch of other stuff for the paper. But there are absolutely times when I say to students, I don't know what this all means. And I'm not joking. Because sometimes I'm not in that discipline. A lot of times I'm not in that discipline. And that's okay. Right? But I can say, absolutely, this is what they're saying for here, for this graph, or for this part, or this, whatever it is. So I get, that's definitely true. But I don't understand this part or this part. I don't understand what they did with this assay. I've never done that assay, things like that. There's plenty of things that I don't understand. But there's definitely stuff that I do, and that's where you want to sort of, where you want to reside, where you want to get to. So anyway, that's what I will offer for you guys for January. Zip-ups will no longer be allowed. These, I don't know what the hell they're doing. So honestly, you know what happens? Every periodically we get new adults in the building, and they think that they're gonna, we change the rules. Whoops. And they change the rules. So on the left-hand side is the current expectations. On the right-hand side are the future expectations. In January, so hoodies are not permitted. There's a huge push to get rid of hoodies, right? And so I'm just warning you. Any questions about that? please be reminded that it is expected a scrub top is worn, underneath the zip-up cardigan every day. So particularly embarrassing for me, I'll just say to her, right, honey, can you take that hoodie off? No. Really? Come on. Why are you arguing with me? Because I don't have anything underneath. And then I just walk away, and then if you get in trouble, then they deal with it, right? So don't do that. Once again, if you don't obviously disobey this rule, they're gonna overlook it. Right? If you don't flaunt it, they're gonna overlook it. If you're close to being what they expect, they're gonna overlook it. On the other hand, they also might, they being the adults that care about this stuff, they might want to make some seniors examples. So I don't know how it's gonna go. All right? And I'm just warning you. So now let's go to the topic at hand, or the topics at hand. And so several of you walked in this morning and you're like, I can't do this anymore. I'm Georgia Adini, she's like, so you're all like, oh God, this is. Just get to next week. Just get to next week for right now. Don't think about this semester's never going to end. Don't think about anything like that.
That's what I would think.
No. So if you think that the semester's never going to end, then you're going to stop studying. You're going to stop studying right now. If you just say, all right, I just need to study for this week, and trick yourself into thinking that, then you can go on. Right? There'll be a little bit of a respite after Tuesday. Right? You'll have a little bit of a break, not a huge break, granted, but there'll be a little bit of a break, and then we'll get back into it. But just one more week. That's all you need. Okay? Study your ass off. Yes.
Is it normal to study for 6 hours for 4 goals in this month?
So it's normal to study for a single exam 40 hours. Okay? And then you feel like, all right, I'm starting to get this stuff. And then you might be getting a B or a B plus. If it takes you 40 hours or 6 hours to do 4 bones, then hopefully what you've done is set yourself up for when we start talking about it today or tomorrow, like, oh shit, I know this. Right? So it depends. Like some of the stuff, you're gonna sit down and you're gonna say, oh, this is easy, I get this, I got it, no problem. Like the vertebrae, you might say, no problem. Other stuff, you might say, I'll never get it. And that's the stuff that you have to really beat yourself over the head with. But you can't, if you don't study really rigorously, if you don't study really actively, then you're not gonna know until the exam. And then guess what? You get a bad surprise.
Perhaps.
What?
Okay.
So, I'm gonna start the lecture here, and so what I expect is that everyone has their phones face down at the very least, if not away. Headphones and earbuds and everything else out. Do we have it? Hey, Eliane. Yeah, thank you. So generally speaking, being an old man here, my kids would say, yeah, you got your old. I can hear you, even if I have earbuds. Right? That's what they say. My kids, my biological children. It looks like you're listening to music, you don't care what I'm saying. So looks are important. So if you're sitting in a lecture, make sure that if your phone is visible, it is like way away and you're not using it. If you're sitting in a lecture, just as a rule of thumb, don't have earbuds or headphones or anything. All right. This should be a familiar part of the lecture. We're going to start this. We're going to do this part of the lecture. We're going to finish up the axial skeleton. We're going to take a break. I'm going to go get a cup of coffee, and because you're making me yawn. Yeah, you're just yawning. No, actually, I do want to know on that. Then I'm gonna show you some pictures, and I want to sort of, let's talk about the pictures themselves. Let's talk about the views of the skull and the vertebrae, and then we're gonna jump into the pectoral girdle. Tomorrow, we're gonna finish the pelvic girdle, we'll do some more review, and both with pictures, and then we'll review the skeletal, the osseous tissue and integumentary system, and then we'll be good to go for Thursday and Friday. What are we doing for Thursday and Friday?
Bones.
Which bones?
The pelvic girdle.
I meant the pelvic girdle.
So the pelvic or the pectoral?
Pectoral.
The pelvic, which is the pelvic girdle?
It's a good question.
They both begin with P, right? And they are a little bit different, right? The pelvic girdle is down here, the pectoral girdle is up here, okay? If you want, I can do, and this is entirely up to you guys, if you want, we can do all of the bones of the axial skeleton, which bones behind your back next too.
No.
So that would be, that's a good test. What?
Wait, Friday is pelvis girdle and down?
Yeah, pelvic girdle.
Yes. So the hips, the pelvic girdle, the os coxae, this part right here, right?
Mm-hmm.
And down to your toes.
Okay.
What?
That's all for the liver?
Yes.
So we're not doing the skull?
Okay, yeah. Could someone answer that?
We did this.
Oh, we did?
Why was I studying that for 6 hours? Oh my.
I don't know. So let's talk about the vertebrae here. If you look on the right-hand side, there's 26 bones in an adult and 33 to 34 in an embryo. Why is it 33 to 34? Because the coccyx might be, you might have more coccyx bones than I do. The bones will fuse, right? So bones tend to change over time. There's 5 groups of bones there, and you should know superior to inferior, inferior to superior, what's in the middle, what's associated with the abdominal pelvic region, or the abdominal region, what's associated with the pelvic region, what's associated with the brachial region, or the thoracic region, right? The cervical region. You know that the function of the vertebral column is twofold here. It's supporting the weight of the head and the trunk, right here, and then protecting the spinal cord. While it's protecting the spinal cord, it's allowing spinal nerves to go to the periphery laterally, and we'll talk later on this semester about the spinal nerves. The other thing is all those bumps and things that stick off the vertebrae are sites of attachment for either ligaments, tendons, and or muscles. The spinal cord is not straight, perfectly straight, in one direction. So now in an anterior posterior direction, it is not straight, and here's what the spinal vertebral column looks like. There are these curvatures here. There's cervical, thoracic, lumbar, and then there's some sacral one. This sacral one is not very visible, obviously, but it is visible in the skeletal system, but not in the person. This thoracic curvature is definitely visible. It's beginning in the lumbar area of the body, and it goes up. And so that's definitely visible. Now, why did I say that it's anterior posterior? In other words, so this is anterior, where my pointer is, this is posterior. Why did I say this is curved, but laterally it's not curved? What happens if you have a curvature laterally? What's that? Anyone know what that's called?
Scoliosis.
It might be called scoliosis. It depends on the specifics. What did I say about answering questions? Sometimes I ask questions and the answer's on the board, and I know that. Right? There's other things. So there's, these are not, these are abnormal curvatures that are less frequent here. Most often, scoliosis is what we see most often, particularly with young women. One of the things, if you look on the left-hand side, all of these terms right here are possible questions about the individual vertebrae. A generic, what I would call a generic vertebrae, a vertebrae that is unfused and that has lots of stuff sticking off, including the foramen, the vertebral arch, including the pedicel and the lamina, the body of the vertebra, transverse and spinous processes, other articular processes which are not very large, and then intervertebral notches. Those intervertebral notches, as the name would indicate, are between, if there's one vertebrae sitting on top of another one, they're not touching literally. You have a little bit of a notch, and does anyone know what that notch would allow to stuff to pass through? Why is that notch there? And what happens if that notch is compromised?
Paralysis?
It might be paralysis if it's that extreme, but if it's minorly compromised, you have real pain. You have pain in the cervical, intervertebral notch would be a pain in the neck, which is what I got all in front of me, a whole bunch of pains in my neck. But this intervertebral notch is for the spinal nerves to pass through. So it goes from the spinal cord out to the periphery, and without that space, right, you can get pressure on the nerves, and that can cause pain, or indeed paralysis. So again, now general features of the vertebrae, these are all things that you should be able to recognize and identify, except for the ones on the upper right. So this part right here is something that we haven't talked about, and so this is what the two vertebrae. Here's the superior, the first vertebrae, the superior vertebrae. This is the inferior vertebrae. What type of vertebrae is this probably? Where my pointer is. So we have 5 total possible choices. I would tell you that the coccyx and the sacrum are not possible choices here because they're fused. So now we only have 3. What possible choices would this one be? What's my pointer pointing to?
The spinous problem?
The spinous process. If it has a significant spinous process that projects posteriorly and inferiorly, and it goes significantly beyond the body, then it's a thoracic vertebrae. So this is a thoracic vertebrae. And you can see the distinction between the superior, the inferior, the upper and lower vertebra, with the intervertebral disc keeping that in place, or keeping those two things separated. Another thing to recognize is that if you're looking at this from superiorly, right, you should, as we are now, I should be able to say to you, what side of the body is my pointer on this vertebra? So what side of the body is it? Right or left? So if anyone thinks otherwise, right, you gotta rethink it. So this is anterior, as the name, you see the label there is anterior. Posterior, we're looking from above, coming down, so we're looking down like this. It's on the right side of the body. These are drawn, the top part is drawings, and the bottom part is actual pictures. So these intervertebral discs have a series of fibrocartilage, and that fibrocartilage comes in 2 parts to it. There's an external part and there's an internal part. The internal part is a little bit more gel-based. The external part is, as the name would say, is annulus fibrosus. That fibrocartilage is really strong and basically keeps everything together, right? And then the nucleus pulposus is the nucleus is the center of it. That nucleus, there's that squishy stuff. And if it becomes too compressed here, a couple of things will happen. The first thing that will happen if these discs get compressed, you get shorter. And then if compression really happens a lot, then this can get compromised and you can have pain. My daughter is dealing with that right now. I don't know what happened to her this summer, but she has a bulging intervertebral disc, and then as a result of that, it's pushing on some nerves and it's causing her pain. So a bulging disc is not a herniated disc. A herniated disc here, if you look at this picture right here, again, now we have the superficial portion, the annulus fibrosus, and then a central portion, the nucleus pulposus. That nucleus pulposus, when it gets pushed out and it emerges from the annulus fibrosus, and then it pushes out and pressures that spinal nerve, then you could have, depending on the severity of it, right? A minor pressing could be pain, more severe pressing could be a lot of pain, and then dramatic compression could perhaps kill that nerve. If it does kill that nerve, there's a chance that the person wouldn't be completely paralyzed, because this individual nerve right here is only going to serve a certain part of the body. This might serve this is going to serve another part of on the other side of the body. And so any type of pressing on those spinal nerves will cause some type of impairment. So this herniated disc here is, the herniation is a dramatic one, and if you have a bulging disc, then rather than the nucleus pulposus coming out here, you would just have it getting pushed closer to the edge, and as a result of getting pushed closer to the edge, the annulus fibrosus gets pushed out too. All right. So this is definitely something that you should recognize, right? There's cervical, thoracic, and lumbar vertebrae here. We're looking at the left sides of the vertebrae. We can see many of these same things here. So the spinous processes, the spinous process, and the spinous process, if it's rounded and short relative to the entire length of the vertebra, but a large one, then it's a lumbar. I already talked about the spinous process projecting much more inferiorly than the body. That's for thoracic vertebrae. And then for cervical vertebrae, that spinous process may or may not be here. In addition, that spinous process might be what's called a bifid. Bifid spinous process means that it's a single projection, and then it projects out with two fingers. It's like the peace sign. And that is true for several of them, right? So for 5 of them, not for 7 and not for 1. In terms of articulations, another thing that I'll ask about is, here's a vertebrae, what's articulating superiorly, what's articulating inferiorly, what direction is that surface going to project? Really the vertebrae, the cervical vertebrae sort of, for the superior and inferior cervical vertebrae, more or less project superiorly, inferiorly. So that's what it says right here. Let me see here. The superior articular facet right here for thoracic vertebrae, the superior articular facet faces posteriorly, the inferior articular facet faces anteriorly. So this is not the inferior articular facet would be right here, and it faces this way. And then the inferior articular facet for the lumbar is facing laterally. The superior articular facet, which is right here, this is the process. The facet's on the other side. That's facing medial. So the lumbar vertebrae is medial and lateral. The thoracic vertebrae are anterior, posterior, and the cervical vertebrae are more or less superior and inferior. Not quite. As they get closer and closer to this C7 here, that gets to be the biggest cervical vertebrae. That gets to be very thoracic-like. So I wouldn't ask about those, right? And the same thing is true for the thoracic vertebrae. As the thoracic vertebrae start to get bigger and bigger, especially in the lower ones right here, they get much more lumbar-like than thoracic. So we won't worry about. I won't pick those. I'll pick the ones that are much more common here. So we'll talk about the cervical vertebrae here. This bifid spinous process, I don't know if I've talked about this in a mini practical, or or identified it for you. I'll talk about it today. There's, C1 and C2 is the atlas and the axis. The axis here has the odontoid process, or the dens. That is a superior projection that is basically, it's this. There's another reason why I get the flip you off. So the if the axis has this projection right here, the atlas has this, the body, the absent body, and the atlas then can rotate around the dens or the odontoid process. And we talked about the articular facets or the articular processes. Upper left is the atlas and their lateral view, but particularly this one right here. Upper right is the axis. And then this is a combination of the atlas and the axis. That combination of the atlas and the axis has a ligament, and if you go like this, right, the reason why you can go like this partly is this dens or this odontoid process allows for the movement of the head in relation to the rest of the body, right? And what also helps keep that from slipping is that transverse ligament that I'm pointing at right there. So that transverse ligament is basically holding the dens to the axis right there, and again, you can see this superior articular facet. You can't see the inferior articular facet, you can see the dens. And then finally, there's three foramen, there's a vertebral and two transverse foramen. Because there's two transverse foramen, there's not very significant transverse processes in this cervical vertebrae. And the transverse process really is basically, as it grows out, we basically build a hole instead of the whole process. More pictures. Bifid spinous process as you go inferiorly, so somewhere between C2 and C6, right here where I'm pointing to right here. If you look at the upper left-hand corner of this picture right here, you can see the bifid spinous process. Again, that spinous process is projecting posterior. It looks like the peace sign right here. It helps form, it's posterior to the vertebral foramen. And what I'll say again now, this vertebral foramen, I'm just going to try and say this once. The vertebral foramen and the vertebral arch there is the posterior part of the vertebral foramen. It's formed principally by the lamina, which extends from the transverse process or the transverse foramen to the spinous process, and in this case the bifid spinous process, back. And then there's a slight extension from the body, a much, much smaller extension. The body of the vertebrae is the pedicel. So the combination of the pedicel and the lamina form that vertebral foramen, and the anterior portion of the vertebral foramen is always formed by the body. So the next one here is the thoracic vertebrae here. This thoracic vertebrae has 12 vertebrae. I'm not going to ask you that, but they do, so there's a lot of vertebrae here. This is the one vertebra that articulates with another bone. There's another vertebra that articulates with another bone. What is it?
Cervical vertebrae?
And what bone does it articulate with?
C1 articulates with the skull.
Not the skull. What does it articulate with? What bone?
The occipital condyle.
So the occipital bone or the occipital condyle. Now, inferiorly, there's another bone that articulates with a vertebra. What is it?
Maybe the sacrum? Sacrum?
The sacrum, and what does it articulate with? What does the sacrum articulate with?
The lumbar?
The lumbar vertebrae.
No, sacrum, so the sacrum articulates with vertebrae superior, no question about that. But the sacrum articulates with something else, laterally. What does the sacrum, which one? And which bone? We don't have a pelvic girdle, which bone?
Coccyx.
Not the coccyx, that's a vertebrae, right? That's inferior. Laterally, what does the sacrum articulate with? Not up and down, right? Not right down the midline here, because we said the sacrum here, superior to it is the lumbar, inferior is the coccyx. Dave.
I just said hip bone.
We don't have a hip bone. What do we have? Oh, so there's a hip bone. You're not going to see the word hip bone on an exam or on a quiz. I'm not going to. If you say hip bone on a mini fractal, that's wrong. right? Because we have to elevate our vocabulary and we have to be more specific. So what is the name of the bone that articulates with this sacrum? So there's os coxa would be one acceptable term. Now, within the os coxa, there's three bones. What are the three bones?
Oh, it would be the issue.
Ischium, what's the other two bones? Pubis, and the last one is the ilium. So the ilium, ischium, and pubis is part of the os coxae. There's three on the right, there's three on the left. Together with the sacrum, they form the pelvic girdle and a little bit of the coccyx. But of those three of the os coxae, the ilium, the ischium, and the pubis, just of those three, one of them, just one, articulates with the sacrum. Which one?
It's the pubis.
Not the ischium. Don't say the pubis. The pubis is anterior. The ischium is posterior inferior. The ilium is superior lateral, right? If you put your hands on your hip right here, that's the ilium. If you go back posterior a little bit, that's going to be the sacroiliac articulation. What does sacro mean? Sacrum. What does iliac mean? Ilium. And in cartoons, when I was a little kid, I used to watch Bugs Bunny, and he would, like, you know, he'd fall from a skyscraper or something like that, and he'd say, "Gosh, I broke my sacroiliac." Obviously, sacroiliac articulation. I can still remember that. Like I was like, you know, in third grade talking about the sacroiliac, and I'm still talking about it. So the point that I'm trying to make here is that I want you to anticipate the types of questions I'm going to ask. So not only am I going to ask about the parts of this vertebrae, what does it look like, what is this thing and what is that thing, where is it located in the body, I'm also going to ask about what it articulates with. So, the articular process, we already talked about the articular processes being anterior, posterior. Part of the articulation of thoracic vertebrae, they have facets, and these things, a facet is a point on the body and also a point on the transverse process, and that's a point of 2 points of articulation for the rib. Now, don't get confused. Sometimes you'll see, let me see if it says that. So this is a superior, this is articular facet. Sometimes they also call it a demifacet. So demi means part or half. That's just a point of articulation, because what happens is that the ribs, sometimes they meet a single vertebrae, and other times they meet a pair of vertebrae. They hit the lower part of one and the upper part of another, and so then they have demifacets. I'm not going to ask you to distinguish that. A point of articulation with the rib is just a facet. The spinous process that is the biggest one, shortest, thick, is found on the lumbar vertebrae. The lumbar vertebrae basically does not lots of rotation there. It is very, very strong, and there's only 5 of them. So this is 1, 2, 3, 4, 5. This last one right here is L5. What is inferior to L5? The sacrum. What is superior to L1?
Thoracic.
The thoracic vertebrae. Now, if I were to, I don't think that I would ask a question like this, but since I'm going to make it harder now. Which thoracic vertebrae is superior to L1?
Would be T12.
T12. Right? Which sacral vertebrae is inferior to L5?
S1.
S1. Do you have an S1? If I were to open you up and look at your sacral vertebrae, could I say this is S1 because I could pull this out or I could pull this out? I could definitely do this to your lumbar vertebrae.
No, because they're fused.
They're fused. So developmentally, when we're born, right, our vertebrae aren't fused. At that point, we're not able to walk. So Mrs. Gaspar's son, right? So he's starting to walk and he's being a real pain in the neck for them now. And I remember when he was born last year, I was like, oh man, this is awesome, enjoy it. Just wait till he starts running. Then this shit's gonna hit the fan. Because, and that's what's happening, right? So, she has friends, she told me that they just had they have like a 1.5-year-old son, and then they just had another baby, or a 2-year-old son, and they just had another baby, and they're like, I can't believe we used to get stressed out by this little baby that's not doing anything, it's just in the bassinet, and just like, and then sleeping, pooping, and eating. That's all they do, right? Now the kids, when they're toddlers, they start to run, and then they start to do really ridiculous things. Like my son was in January, we were going swimming, and it is snowing out, it's cold, freezing rain. We're at the YMCA in North Attleboro, cold, freezing rain. Come on, buddy, let's go take a shower. No. Why? I want to wear my bathing suit home. So there's fun things like that, right? So half hour later, we're still not getting dressed. It was a real pain in the ass. It was very stressful. But back to this stuff right here. So what are we gonna talk about next? So this is the 3 unfused vertebrae. And now we have the 2 fused vertebrae. Oh, this is just a distinction between the lumbar and the thoracic. Here on the right-hand side, we have the lumbar, and the left-hand side is the thoracic. And you can see this obvious extension here of the spinous process. Right, more of this pictures. So if you look at where my pointer is here, so first of all, up top on the left-hand side, this is the anterior view, inferior, on the lower left-hand side is the posterior view. So I won't ask you 1, 2, 3, 4, 5, but if you look at all those horizontal lines right here, all of those transverse lines, you don't need to know what those are. But if I just count it here, there's 1, 2, 3, 4, 5, and then there's the coccyx bone. So that's where we get 5 sacral vertebrae. We're just treating it as a single bone here. If you look on the right-hand side, there's all these terminology to know. Anteriorly, the thing that is most obvious, the anterior is the sacral promontory. That's sort of that smooth surface right here, and obviously that smooth surface with the anterior sacral foramina, those holes right here. This surface right here, this projection superior and lateral is called the ala. And this auricular surface is the surface that I was just talking about, the sacroiliac surface right here. So now the sacroiliac surface here, the auricular surface is present on the sacrum, and there's also an auricular surface present on the os coxae. We will talk about that. Posteriorly, the most prominent, obvious projections there is the medial sacral crest. That medial sacral crest are the fused spinous processes. So this vertebrae has to be very, very strong, and so this fusion happens there. Let me see, there is this superior articular facet that articulates with the lumbar vertebrae, so that's superiorly. There's this lateral articulation we just talked about. And then there's the coccyx bone. And if you look right here, there's between 3 and 5 semi-fused vertebrae. What is this, if any of you guys have a pet? A pet mammal, a dog or a cat. What would the coccyx be in that?
Is that their tail?
That would be their tail. That absolutely would be their tail. So we don't have a tail. You may have 3, I may have 5, and we're perfectly normal people. So the pictures right here are blown up some. So now let's talk a little bit about the thoracic, so the thoracic cage, the thoracic cavity. What bone or bones form the lateral thoracic cavity, the ribs? What bone or bones form the anterior thoracic cavity, the ribs and the sternum? Here. What bone or bones form the posterior thoracic cavity, the ribs and the vertebrae? And when you talk about the vertebrae here, we're talking about the thoracic vertebrae. So the ribs come in 3 varieties here. There's true, false, and floating. Here I particularly want to focus on true ribs. Here, what's the difference here? The true ribs are directly attaching to the sternum. The false ribs say, merge into cartilage here, and that when they merge into the cartilage, then it articulates with the sternum inferiorly. And then finally, there's a couple of floating ribs that are inferior, and they're basically, if you reach down right in the small of your back, it's called, or right inferior to the thoracic vertebrae a little bit, that's about where your floating ribs are, and that's about where your kidneys are. These floating ribs don't attach to anything, so that's the name. So there's true ribs and there's false ribs. I won't ask you how many of each there are, but the distinction I might ask about. So if you look at this picture right here we have the sternum medially. So these bluish areas right here is the costal cartilage. So what I'm pointing to right there are true ribs. And then if you go down here, these are false ribs because several costal cartilages several ribs merge into costal cartilage for one costal cartilage, and then that goes up. So the thoracic cavity, if you put your hand on your sternum and then on your xiphoid process, which is where my pointer is right here, your ribs actually go significantly inferior to that. So if you put your hand right there, one hand right there, my right hand and my left hand, right? So that is much further down. So that's pretty straightforward, right? Now, the last thing I want to talk about here is what is shown in the lower part of this slide. Oops. I thought I had another picture. Yeah. Okay. So if you look at this picture right here, this picture right here has 3 bones. There's 2 vertebrae and a single rib. That rib right here articulates right here, and then it articulates right here. This part right here, because there's 1 rib articulated 2 vertebrae, the book and other notes online, you might see the word demifacet, a costal demifacet. I'm not going to use that term, it's just going to be a costal facet. So this is a costal facet, that's a costal facet, that's a costal facet. This one right here would be for the next vertebrae and for another rib right here. So there's a couple of parts of the points of articulation with the rib. First is at the body, right, and close to the pedestal, but essentially at the body. And then laterally is at the transverse process. So where does that happen right here? So right here, there's 2 points of articulation, one at the head of the rib, and then the other at the tubercle of the rib. That tubercle, the point of at the tubercle is where the transverse process is taken. That then goes to the angle, or so that we're going projecting. So now, if we're talking about where is this in the body, this is posterior, and then this is the sternal, and this is anterior, and this is lateral. Okay. Yeah, sorry. The manubrium has the sternum has 3 parts here, the manubrium, body, and the xiphoid process right here. The manubrium is the only one that articulates with a non-rib, right? And the manubrium articulates with the sternum, right? Now, what bone does it articulate with? What am I saying? What does this manubrium articulate with?
Clavicle.
The clavicle, right? And it's right there. And this is the rib, right? All right, so let me do one thing here. If you look right here where we're pointing right here, this point right here is a point of attachment for the head of the tubercle of the rib, and then the head of the rib, you can't really see it very well. If we go back a little bit, I mentioned the sacroiliac joint. So this right here, my pointer is at L5, right here, this is S1, right? And then this point right here is the sacroiliac articulation. And so this is the sacrum, lateral to that is the ilium, and then we'll talk tomorrow about the ilium, the ischium, and then the pubis. Let's see here. Talking about the coccyx right there, right? And then go up. We have the bifid spinous process right there on the vertebrae, of the cervical vertebrae, and these transverse foramen along with the vertebral foramen. Okay? So, let's see here. It is almost 9:30, so let's take a 10-minute break. So, and we're gonna do the pectoral girdle.
Wait, mister.
Gertrude, what?
Dr. Fancy, I suppose.
Oh, hi. I don't remember what your name is. Giuliano, I suppose.
Huh? Perhaps you're right. How do we know that ATP and all that stuff is real? Like, how do you know an atom is real? It's so tiny you can see it, so how do you know?
What?
How do you see like the cells of Mary? I did the whole
What?
How do you see like the
Wake up!
No, but actually I didn't buy that one.
Like, how do they,
So,
like, how do they
I mean,
get this?
originally, you're talking about lots of complex experiments, right? So first of all, what do you have to start with, right? So we start with glucose, we put it into the cell.
But how do they get the cell?
I like this combo.
What? Did you just look at the video that worked the conversation?
Probably like scraping like someone like a part of someone's body.
Like, how do you figure out the citric acid cycle and say you need this?
How do you know?
Wake up!
Wake up.
They have no idea what we're talking about.
TikTok is so funny.
They just pretend that they know that they're basically spouting bullshit.
Wake up!
So there was a lot of discussion for a long time. So you know what the body is doing, right? So just look at yeast. Yeast makes beer. But so yeast is a single-celled organism, and under aerobic conditions, when oxygen's around, they do one thing. When it's anaerobic conditions, they do something else. In anaerobic condition, they make alcohol. Right? So if you take those individual yeast cells and you put sugar in it, and then you kill it right immediately, what chemicals in there? Oh, there's a lot of alcohol in there. There's a lot of what's called pyruvate. Okay, so now we know what we can say what the pyruvate is. Now we know what the chemical, glucose is, right? We take glucose, we break it up. Now we have 3 carbon sugars. Okay, so then where the hell does that go? Well, yeast has mitochondria. Right? So let's look at the mitochondria. There's a bunch of mitochondria in individual yeast cells. When the mitochondria are around and when there's oxygen around, then they start firing off stuff. If you're going to make beer or make wine, you want it to go anoxic. So you want the oxygen to get out of the solution, and so you don't let it bubble up and sort of have access to the air. Right? You cover it up, and with a little bit of time, then that yeast goes anoxic. But if you allow it to have oxygen, then it goes through that process, and you can measure with microelectrodes the amount of carbon dioxide getting spewed from that little mitochondria. And if you measure the amount that you put in, then you can measure the amount that puts out. Now, might not be perfect, but it's pretty close. Now, as far as your original question, like how did they do it in the 1800s or the 1700s? It's pretty cool stuff.
They steal people's ideas too.
What do you
No,
mean?
absolutely.
From
People-
like back in the day.
They absolutely steal people's ideas. Everyone, and so the most egregious example was, you know anything about DNA? Well, there's these two guys named Watson and Crick, one of whom is still alive, his name is Watson. And he's,
No way.
he is a guy named who's sort of, has said stuff about, racial identity and genetic, sort of sexist, I think. Basically, men are smart, men in particular, white men are the smartest. And obviously, white men in this room is the smartest in the room. But that's only because it's me. But he's actually been saying racial stuff about that. But regardless, now back in the 1950s, Watson and Crick are working in the laboratory. Now this woman named Rosalind Franklin. Watson